Good afternoon, everyone. My name is Anya Spratley, and I'm a resource navigator here at Family Reach. I would like to begin by welcoming all of you to the second episode in the Family Reach Sessions educational series. Today's panel discussion is titled Caregiving and Cancer, Staying Organized and Supported, and it's sponsored by Karyopharm Therapeutics. We will be recording today's session and it will be available for future viewing on our website. Our panel today will focus on the experience of caregivers who have a loved one with cancer. Our hope is to provide some tangible tips that caregivers can use to stay organized and supported. And most of all, we want caregivers to know that they are not alone and support is out there. I would like to thank all of you who are joining us for this panel for taking the time to be with us for this discussion. And I would also like to thank all of our panelists for being open and willing to share their experiences by participating in today's event. And of course, we would like to give a big thank you to Karyopharm for their sponsorship and collaboration on the Family Reach Sessions series. Please keep an eye out for the next episode in this series, which will be coming soon. And now I will turn things over to Iris Gibbs, the head of Regulatory Intelligence, Advertising and Promotion, and Government Affairs at Karyopharm, who will be our moderator for today. Thank you, Iris.
Thank you, Anya. As Anya mentioned, I'm Iris Gibbs. I've got a shortened title now that encapsulates all of those things Anya just listed, and we'll call that Commercial Regulatory Affairs at Karyopharm Therapeutics. I'm honored to be joined by my fellow panelists and look forward to having a really meaningful and impactful discussion with you all today. I'd like to start by welcoming Marcus Cox. Marcus is a caregiver and husband to his wife, Nicole. Nicole is a two-time breast cancer survivor. Next, I'd like to welcome Gina Kell Spain. Gina's caregiving experiences are many and varied. She was primary caregiver when her late husband, Matt, was diagnosed with leiomyosarcoma at the age of 32, and again stepped up as primary caregiver when her son, Sam, was diagnosed at the age of when her son Sam was diagnosed with a grade 4 glioblastoma in 2014. We are happy to inform you that Sam is now cancer-free. With her remarkable lived experiences, Gina knew she wanted to help others. So in 2007, she and her husband, Michael, founded the New Day Foundation, where Gina now serves as president. New Day Foundation's mission is to provide financial and emotional support for families battling cancer. Welcome, Gina. Rounding out our panel today is Anya Spratley, who we just heard from a minute ago. Anya is a resource navigator with Family Reach, where she helps patients and families navigate through their cancer journeys. Thank you all for joining us today. Before we jump into our discussion, we'd like to first share a video highlighting the story of Marcus's wife, Nikki. The Cox's lives changed in April 2016 when a routine mammogram and subsequent biopsies revealed that Nikki had stage 2 estrogen receptor positive breast cancer, which had spread to her surrounding lymph nodes. Nikki underwent treatment for her cancer and was cancer-free in January 2017. Sadly, however, in 2020, an annual mammogram revealed that Nikki had developed a secondary breast cancer and would need to pursue treatment once again. This time, Nikki underwent a bilateral mastectomy, followed by more chemotherapy, finishing in January of 2021. Nikki is now cancer-free and an advocate for young women facing cancer. So let's go jump into the video.
My name is Nicole Cox. I like to be called Nikki. Sounds less formal. I am a newlywed. I just got married a little over a year ago to my husband, Marcus Cox, and we have two girls. I have my daughter, Ava, who is 7, and my bonus daughter, Layla, who is 10. I'm an administrative coordinator for the department. So I come in the office twice a week, and then I work from home 3 days a week. But other than that, I'm just, a full-time mom and wife, and, take care of the household. My first diagnosis was 2016. So in 2020, with my second diagnosis, I was diagnosed in May of 2020, and that was during the pandemic, well, the beginning stage of the pandemic, and also while I was planning my wedding to my now husband, Marcus. It was a series of up and down emotions, as you can imagine. Fast forward to, a couple months later, I had my bridal shower in July of 2020. And 2 days after my bridal shower, I had to go through a bilateral mastectomy. So I was supposed to have the reconstruction done, but my plastic surgeon at the time was going through quarantine. So that had to be delayed, but we still went through with the mastectomy. So as you can imagine, I'm like celebrating, once in a lifetime day. And then 2 days later, the next day I'm like planning, while putting everything away and coming down from the excitement, I'm also trying to like get my mind ready for the following day because I have surgery that Monday. So, it was a lot to take in, and just not knowing, how I was going to feel on my wedding day without any breasts. So that was another thing that was hard for me. Whenever I was first diagnosed, me and Marcus were roughly almost 5 years into our relationship. I honestly, like, you're 30 years old, like, I'm a young woman. So of course, my appearance is important to me. Not knowing what was to come, but knowing that I was going to lose my hair was a lot. I just didn't know that if this was something that he could, carry. It was definitely new for us, of all the unknowns, not knowing what was going to happen took a toll, but especially losing my hair, was a really a big adjustment for me. And he took that on with such grace. He was very supportive. He always told me I was beautiful, made me feel, loved, and, everything in spite of that. So even just, feeling that people were staring at me because I was bald and would have to wear a scarf on my head. And, he took it upon himself to put one on just so that I wouldn't feel alone or stared at. So those small but monumental gestures that he took, was so huge. The financial reality of, cancer alone is unexplainable. But the fact that I lost my job, that was just another added level of stress that I did not need. I'm like in a position where I'm trying to work with my patient navigator at the time, trying to find assistance with other programs, financial grants and assistance to help with, cancer patients, to just help us get through. I didn't plan to not work. So, we were going off of, my contributions to the household. So, I'm already taking time off as it is for treatment. And then now I don't have a job at all. So it's like, that supplement that I was missing of income was just another added layer of stress that I did not need. For me, it's always important to bring awareness to young adult cancer. Not that any cancer is greater or less greater because of your age, but young adult cancer is kind of, I want to say, it's getting a lot better. I feel that there's more attention to it. There's more discussions around it. But, I think it can always be even better, because we're in the peak of our lives where we're starting our life, starting our families and our careers. And it's kind of like, a halt. We hit a roadblock. Just of our age, we've been through cancer twice and we're 35, married couple. So it's quite the story in itself.
Marcus, I'd like to direct a question to you. I know that video must be tough to watch. I got emotional watching it myself. Can you share what you're feeling after watching the video?
Yes, after watching the video, there's a few range of emotions. Takes me back to whenever, she first got diagnosed, but it also makes me happy to see the video and see how far she's came, what she's overcome. So a few emotions watching the video.
And how is Nikki doing today?
Oh, she's doing pretty good. She's in remission now, so that's a good thing. She advocates for young adult cancer. She's seeing her oncologist regularly. And today, in present time, she's doing pretty good. She's sitting there.
I'm so glad to hear that. I'm so glad she's doing well. Let's take a step back and talk about when Nikki was first diagnosed with the first breast cancer. Do you remember how you felt when she first told you about her diagnosis back in 2016? And what were your next moves?
Yes, I remember. I was just shocked because I never knew anyone that had cancer, let alone, my spouse. So it was very shocking just to hear those words. It was scary, worrisome. It was just a lot of things going on in my head at one time.
Now, how was your reaction any different with the second diagnosis in 2020?
The second one, I took the second one harder because just hearing it coming back, you automatically think the worst with, it coming back. So that one was a little tough to deal with at first initially hearing. I took the first one a little better than the second.
Understandable. Thank you, Marcus, for sharing your story. Gina, having been in a very similar position to Marcus, did you share any of those experiences and emotions when your husband was first diagnosed?
I did. We had two little boys at that time. And, anytime you hear the words that you have cancer or that someone that you love very dearly has cancer, yeah, there's a moment of utter shock. It's that life interrupted moment that everything that was important to you 5 minutes ago no longer matters. And you have to redirect your attention, your life, and your focus in a completely different way. And that happening in just an instant is all it takes. And that moment is definitely challenging.
Absolutely. Thank you both for sharing your experiences with those diagnoses. Let's switch gears and discuss your roles now as caregivers. Marcus, let's start with you. At what point did you realize that your life and your responsibilities for family and Nikki were going to change? And who did you turn to for help?
Pretty much instantly is when I knew that, things would definitely change. But I knew, we'll believe, that she would beat it and, we would get through it. But it definitely, it hit pretty hard. People I turned to was my best friend was the one person I turned to. And later on, there was outlets. There was a young adult cancer group that focused on a lot of co-survivors. My uncle's a pastor, reached out to him. There's just a lot of family and friends we reached out to, and they were there.
Wonderful. Same questions to you, Gina.
Yeah, we immediately reached out to our pastor as well. That was one of the very first phone calls that we made, and that was a big part of our experience, just anchoring us to something for us. It was a very important part of our journey. But there's something really meaningful about being known and being understood, and having that opportunity to reach out to people who've been there. To me, that was a very important piece for me, knowing that somebody else has gone through this and that I could lean on them for just guidance and conversation was important. But yeah, family, friends, they rallied quickly. They immediately jumped into gear and absolutely helped us stay focused and keep our life together, handling kids and households and careers and things like that. So no joke, it takes a village.
Absolutely. And Gina, I wanted you to think about also, when did you realize the responsibilities were going to come to you to be the primary caregiver?
Well, immediately. My husband was, not sick in the classic sense for quite a while. So I guess, we had about a year, maybe a year and a half even, before he became sick to the point where he needed me in full caregiving mode. So we were a pretty good tag team at first, but then it soon became that things shifted. And when that shift happens, and frankly, with my son, I was in caregiving mode from the word go. So, but when you have that happen to you, your life, whatever your career was, whether you were a stay-at-home mom like I was at that point in my life, or you have a job that you can no longer go to, that's terrifying, and that changes everything. So getting the word that, or realizing in that moment that my life is shifting, my focus is shifting, it's something that I think you have to accept right away. The longer you resist it, the longer you try to stay the course with what you thought was your normal life. You have to let go of that, and you really do have to accept what's ahead of you, and know that you're not alone. There are people that you can connect to, and that you can actually find your way through it. I mean, that's for me, that was what it was. And having that, I honestly, the thing that crushes me is when I hear people who don't have a support network, who don't have the family, friends, community, neighbors, churches, schools, who come around and really do the meal train thing, that's the part that really, to me, is a vital part of this, so that when you go into caregiver mode, you've got backup when you need it.
All great insights. Absolutely. Thank you, Gina. Gina, let's stay with you. Can you take us through the moment when you realized that the cancer was going to take a toll on your financial health?
Yeah, so that's a terrifying part of this, and that I think most people really do not consider until they're further along in the process. I mean, Nikki, hearing your story about losing your job, I hear that so often, that breaks my heart, because I know you just want to keep working and keep going and doing life, and by the way, paying the bills. The thought of not being able to pay your bills is terrifying, and then the reality of not being able to pay them it can actually directly impact the treatment outcome. So in my opinion, my experiences were unique in the sense that my husband had an incredible employer, somebody who was really willing to go to bat for him, just had his back. So we were prepared to fill out disability paperwork. We had the paperwork, and we kept thinking, how are we going to do this on a third of your income? And we didn't ever have to do it. So that's a miracle in and of itself for us. Most people do not have an employer like that. Most people have employers who, quite frankly, say, if you can't work, I can't pay you, so I'll see you later. That's the reality of it in most cases. That is the whole reason that New Day Foundation started, and we're a lot like Family Reach in that sense. So, providing help to people who are in that situation of losing their income because of their diagnosis. My family's experienced, I would say, an average of and I'm thinking now about this in terms of my son, who was diagnosed in 2015, that 4 years, an average of about $1,500 a month when things were just kind of steady. That was the average out-of-pocket expense that we experienced. And, some months it was higher than that, some months it was a little less, but that's the average. And if you're already paying your bills just month to month, or if you're just getting by, or you're trying to save money, all those things kind of go by the wayside. So financial toxicity, as we like to call it in the business, is real. It has a direct impact on treatment outcomes, and it makes a huge difference in your level of stress and your ability to get through.
I'm just imagining all of this, what you're saying. Thank you so much for sharing that wealth of information. And we're so happy that New Day Foundation is now on board to help people who have financial need. Marcus, can you add anything? I'm sure it was an adjustment when Nikki lost her job. Can you share what you did to get more financial assistance?
Yes. Like I said, when first got diagnosed, she did have her job, so it didn't really hit right at first. Then, hearing that she lost her job, that was, as Gina said, that was terrifying. But there was a lot of financial assistance that we found. And honestly, her losing her job, I feel at the time was sort of a blessing because she was able to just focus on the treatments and not worrying about clocking in or being late for work, just focus on that, get healthy. So, and then we also did a comedy benefit for her. We had a GoFundMe, meal train. There was a lot of things that helped, a lot of friends, family. The community really, rallied around her church. So all good outlets.
A lot of community, family reaching out. You guys got pretty creative, a comedy benefit.
Yeah,
that's pretty cool. That's lovely. So thank you, Marcus, for sharing that. And thank you, Gina, as well. Hopefully our audience today will have some great takeaways for valuable resources from your stories. And speaking of valuable resources, Anya, I'd like to bring you into the discussion as resource navigator. What are some of the things you would suggest that a caregiver could do early on to start preparing for the financial toll of their loved one's cancer diagnosis?
Yeah, so like we just heard from both Marcus and Gina, one of the most helpful things for a lot of people early on might be to figure out who you can rely on for that help and support in your social circle and in your larger community as well. We know that after any sort of big life change or crisis, there are oftentimes a lot of people who want to be able to help, but they maybe don't know the best way in which to help. So it's definitely okay to tell folks what you need from them. So maybe what you need from them would be getting cooked meals dropped off after a long day of treatment. Or depending on your situation, maybe you would like to ask for help with transportation or grocery shopping or childcare. And there are several different online tools that can help with organizing and coordinating these types of requests. So I think both of you mentioned Meal Train as one option, and another online tool that's similar is givenkind.com. And so maybe you can think about someone, maybe a close friend or a relative that you can ask to take some of that work off of your shoulders and to take charge of actually coordinating a page like that for you. Because it can be time consuming. So having someone else take charge of it could be a good idea. Another thing that I heard both Marcus and Gina mention was the importance of their job situations to the overall financial situation of their families. So if you or your loved one is employed, it's possible that you might be able to find some good support through your workplace. You might want to talk with the HR department at your workplace or at your loved one's workplace to discuss whether you'll need to take time off, and if so, how much. Some workplaces might allow some more flexibility with hours or scheduling, or they might be able to help you navigate some of the paperwork that you might need for things like FMLA, if that applies to your situation. So one helpful resource is called cancerandcareers.org. It can be a good place to start to learn more about work during and also after cancer treatment. They have a section that's geared specifically towards information and resources for caregivers. And we will be sending this link as well as all the other resources that we mentioned in an email to everyone who's registered after today's panel is over. Another thing or another place that it can be a good idea to ask for help early on is from the care team at your loved one's treatment center. So many hospitals and clinics have a social worker on staff who can be a great resource for both the financial but also emotional support as well. And meeting with a social worker early on will give them a chance to just get to know you and your situation and the types of resources that you might need. If there's not a social worker at the treatment center, you can ask if there's someone else who could help you find those sorts of financial resources. Sometimes that might be like a nurse navigator, maybe a financial navigator. We have at Family Reach, we have a blog post that includes some examples of the types of questions that you can use to get that conversation started with a social worker or another healthcare professional, and can be a good place to start if you're not sure quite how to bring up those financial concerns. And we'll share that resource, of course, as well. And then lastly, another thing that I would definitely encourage folks to do early on is to connect with the Family Reach Financial Coaching Program. So this is a free service that matches families with certified financial experts. And their role is to really learn more about your family's financial situation and then offer personalized guidance and advice. They'll work alongside of you to come up with a plan for staying afloat as you're moving forward in your loved one's treatment. And they can help you try to get ahead of and maybe even prevent some of those worst financial outcomes of cancer. So they can be a good resource to take some of that burden off of your shoulders and give you the chance to better focus on your loved one's treatment and their recovery.
Wow, there's a lot out there, isn't there? And I'm learning so much just from being a part of this panel today. Thank you so much. I'm not a registered attendee, so how do I get the list? Please, Anya, I would like to also have that list because I am too a caregiver to someone with cancer. I found a lump in my mother's breast last year. And with her memory issues, I bear the decision-making all alone for her care. And because I'm a working person, I didn't know that there's financial resources, and it is taking a financial hit on me to provide caregivers for her as I try to work and maintain my employment. So it really has a downstream effect on caregivers to care for someone with cancer. So I think this panel, Nikki is incredibly strong survivor, and Dina, having had both husband and her son impacted. Anya, is there some tips you can share with the attendees today about how to get organized and feel more prepared to manage this new reality that they find themselves in?
Yeah, so there are definitely a few tips I can offer, but I also want to say that they're not one size fits all suggestions. So feel free as you're listening to think about the ones that would work for you and just kind of leave the rest. So one thing that you could do right away is starting a binder or a folder to keep all of your paperwork and important documents together. You could have a section for medical documents and another section for those important financial documents. Because we know that sometimes those medical appointments can really be a whirlwind, and it might be helpful to have all of your paperwork in one place to refer back to and also add to as you go along. It can help also in staying organized if you are meeting with a social worker, because they will often ask for copies of bills or other paperwork if they are helping you apply for any sort of financial programs. Another tip would be to keep a running to-do list in between appointments. So this could be pen and paper or a list on your phone, really whatever works best for you to add things to when you think of them right away. So the to-do list might include things like you need to call your insurance company to verify the coverage of a medication, or maybe you need to bring copies of utility bills to your next appointment with the social worker. And along the same lines, you could try to keep a running list of questions for your loved one's care team also as you're going about your daily life in between appointments. So that way, whether you're going to appointments along with your loved one or if they're going on their own, one of you can remember the things that you wanted to bring up, the things you wanted to ask your care team once you were meeting with them face to face. You might also find it helpful to schedule time for yourself, maybe once or twice a month, to sort through your bills and insurance documents. So if you're able to do this as a regular routine every so often, It will help keep the mail and also the emails from piling up and becoming more overwhelming to deal with later on down the line. And then my last tip is to encourage caregivers to download a copy of the Family Reach Financial Guidebook. This is a free resource available on our website that helps walk you through all of the different costs associated with cancer treatment that you might want to think about in advance. It can help you feel more prepared to address those financial costs of cancer, and it includes a lot of action steps to take in many different financial areas. So another tool that it includes are some worksheets that you could print off and then use to stay organized with things like the cost of insurance or household bills or other expenses as you're moving throughout the year.
Wow, wonderful. Thank you so very much for that, Anya. A cancer diagnosis is always an unexpected turn in life, and our panelists today dealt with it twice. So it's a, doubly unexpected, of course. Are there any tips, Marcus, if I may call upon you, that you and Nikki began to employ in your journey to manage appointments, manage all the things of running your household and keeping your kids, happy and fed? Can you share any tips you guys use to keep Nikki, not as stress-free as she could be?
So I'll help him out a little bit. So more or less, we kind of follow that system that Anya had previously mentioned, as well as far as the binder system. When you do leave the hospital, my doctors did give me a binder of information to have, and with all our doctors and et cetera. So we were able to utilize that for, my medical team, and then also like any important paperwork that would be needed, whether it was financial or medical, moving forward. So that was, something we did. And we also, like, Marcus had mentioned, had additional support outside, like with family and friends, those who had stepped up to help, when I couldn't do it, or when he had to work. We had family and friends who were able to take our girls places for us, babysit them, watch them, take them to school, whatever we couldn't do based off the needs that needed met. So, if you do have the support, it is important to put your pride aside and ask for help when it's needed.
Yeah,
I would think so. Marcus, anything to add?
Yeah, just the main thing is just don't be afraid to ask for help, because it's there. The help is there if you seek for it. And then people are more than willing to help with the financial programs, grants and things like that, support groups. If you need to reach out to therapy, there's just, just don't be afraid to do those things.
Sure. Gina, you're on mute, Gina. Thank you. I want to ask you two questions. I want to ask you the same question. First of all, are there some tips for staying organized that you would share with us? And I kind of want to know more about New Day Foundation. Was that in existence as you traveled the journey of your husband's cancer and your son's cancer? And were you trying to juggle that at the same time?
No, so well, first of all, with regard to the tips, I just heard you guys both mention the binder, and that's helpful. And in fact, I found that some of the hospitals that we were in would hand us a binder full of resources, which I found, for me personally, that particular version of the binder to be overwhelming. The binder that mattered to me was the one that was keeping me organized, that was keeping track of everything from medication to appointments to important information that we needed, like you had mentioned, Nikki. But the one thing nowadays that we have available to us is through our phone. There is an app called Jasper, Jasper. And if you search this app, you'll find that it has really great tools for both caregivers and patients to be able to communicate, like, how are you feeling today? What's your mood? Without actually having to have the conversation. Maybe if somebody's just feeling really kind of punky that day, it's in the app. and you can talk about it that way. So the app is actually a great way to stay organized, track medications, provide some resources to you as well. So I think that's a really cool new tool that we didn't have available to us when we were going through it. As far as New Day goes, so New Day became a thing after I lost my husband. So it was kind of born out of that experience. And truly, I remarried a man who lost his first wife to cancer. We both understood it. So we knew that we had been blessed and we had been given the resources and had that community and had that everything that we needed, and it was still hard enough. So we thought, let's create this organization to try to give back. And over many years, we've slowly been able to build it. So by the time my son was diagnosed, New Day was in full swing, and we were helping hundreds of patients each year in particular in the state of Michigan. That's our focus here. But we were able to, provide financial assistance and emotional support to us, two of the key pillars to overall wellness and health and ability to, get to remission successfully. You need to have every possible advantage available to you, and finances should never be a hindrance to that, nor should emotional stress. I mean, we want to be able to see you as healthy as you can possibly be while going through cancer. If that sounds like a paradoxical statement, it is, because being healthy while going through cancer is something that can be true. You can have a great attitude, you can have acceptance of this disease and what you're going through, and you can face it with that kind of an attitude. And I just believe that it directly affects your outcome. Accepting cancer doesn't mean you're giving up on cancer. It just means that you're making peace with something that is really happening in your life, and not being afraid to ask for help. Like you said, Marcus, that's half the battle. The people that decide they're going to go it alone, they struggle the most. So being able to free yourself up from that, feeling like you're going to be a burden on someone, or like, oh, I can't ask for help. I'm always the helper. I'm the person who helps other people. That's kind of the mindset. It's not that, when you get cancer, all bets are off. You got to ask for help, and you got to be okay with that. And so those are some of my thoughts. I think I just rambled on about a lot of things, but it all matters. So.
Absolutely. It all matters. I totally agree with you. Thank you. Thank you for those wonderful answers. Marcus, I'm going to come back to you now. In your journey, in you and Nikki's journey, were you able to use any of the tips that Anya discussed? Or have you learned something different, especially during the months of the pandemic?
There was an app that you can use. It's called a Bridge. It's kind of similar to the one that Gina mentioned. That's a very useful tool. But the pandemic, it definitely was different being a caregiver, because it was just me, the second time around. Because obviously, everyone was on lockdown, or she couldn't have the visitors that she had before. So it was just a little different in that aspect. It just was mainly me this time with the appointments. Last time it was either like her mom or a family member. So that was the difference there, but still, still was there for her regardless. So didn't change.
Yeah, but I'm certain that it had to have an emotional toll in some regard to have it all be on you for that period of time.
Yeah. Yes, correct.
Okay. Yeah, no. I'm dealing with it too.